My name is Janhavi Komurlekar, and the name of my research paper is The Use of Big Data Analytics in Healthcare. Introduction. The introduction of big data analytics in healthcare will allow to use new technologies both in treatment of patients and in health management. The paper aims at analyzing the possibilities of using big data analytics in healthcare. The research is based on a critical analysis of the literature as well as the presentation of selected results of direct research on the use of big data analytics in medical facilities. Literature studies have shown that the use of big data analytics can bring many benefits to medical facilities, while direct research has shown that medical facilities in Poland are moving towards data-based healthcare because they use structured and unstructured data, reach for analytics in the administrative, business, and clinical area. The following kinds and sources of data can be distinguished from the databases: transaction data, unstructured contents of emails and documents, data from devices and sensors. However, the use of data from social media is lower, as in their activity, they reach for analytics not only in the administrative and business, but also in the clinical area. It clearly shows that the decisions made in medical facilities are highly data driven. The results of the study confirm what has been analyzed in the literature, that medical facilities are moving toward data-based healthcare together with its benefits. Literature survey. Analytics are techniques and tools used to analyze and extract information from big data. The results of big data analysis can be used to predict the future. They also help in creating trends from the past. When it comes to healthcare, it allows to analyze large data sets from thousands of patients, identifying clusters and correlation between data sets, as well as developing predictive models using data mining techniques. This paper is the first study to consolidate and categorize the use of big data from different perspectives. Consideration on using big data and big data analytics in healthcare. In recent years, one can observe a constantly increasing demand for solutions offering effective analytical tools. This trend is also noticeable in the analysis of big data. Organizations are looking for ways to use the power of big data to improve their decision making, competitive advantage, or business performance. Big data is considered to offer potential solutions to public and private organizations. However, still not much is known about the outcome of the practical use of big data in different types of organizations. As already mentioned, in recent years, healthcare management worldwide has changed from a disease central model to a patient centered model, even in value based healthcare delivery model. In order to meet the requirements of this model and to provide effective patient centered care, it is necessary to manage and analyze healthcare big data. The issue often raised when it comes to the use of data in healthcare is the appropriate use of such big data. Healthcare has always generated huge amounts of data and big data in healthcare. Clinical data, that is, the data which is obtained from electronic medical records, data from hospital information systems, image centers, laboratories, pharmacies, and other organizations. Biometric data, which is provided from various types of devices that monitor weight, pressure, etc. Financial data, the economic operations, the records that, and the data provided by the patients, which includes the level of satisfaction, the self monitoring of their activities, exercises, etc., and data from social media. The main challenge with big data is how to handle such large amount of information and use it to make data-driven decisions. In the context of healthcare data, the major challenge is to adjust the big data storage, analysis, presentation of analysis results, and inference basing on them in a clinical setting. Data analytic systems implemented in healthcare are designed to describe, integrate, and present complex data in an appropriate way so that it can be understood better. This would improve the efficiency of acquiring, storing, and analyzing and visualizing the big data. The result of data processing with the help of this analysis is to appropriately data storytell, which may contribute to making decisions with both lower risk and data support. This in turn can benefit the healthcare stakeholders to take advantage of the potential massive amounts of data in healthcare and to ensure that the right intervention to the right patient is properly timed, personalized, and potentially beneficial to all components of the healthcare system. Analytics of large datasets must connect communities involved in data analytics and healthcare informatics. These are the big data analytics applications, and this is the process of big data analytics. Big data analytics in healthcare can be divided into the following types: descriptive analysis, predictive analysis, prescriptive analysis, and discovery analysis. Methodology. The research is based on a critical analysis of the literature as well as the presentation of selected results of direct research on the use of big data analytics in medical facilities in Poland. The aim of the study was to determine whether the medical facilities in Poland use big data analytics and if so, in which areas. For the purpose of this paper, the following research hypotheses were formulated. First, medical facilities in Poland are working on both structured and unstructured data. Two, medical facilities in Poland are moving towards data-based healthcare and its benefits. Results. On the basis of the literature analysis and research study, a set of questions and statements related to the research area were formulated. The results show that the medical facilities use a variety of data sources in their operations. According to the data provided, considering the first statement made in the questionnaire, almost half of the medical institutions agreed that they rather store and use structured data, which is in the form of databases and data warehouses, and some of them entirely agree with their statement. As much as 23.35% stated I agree or disagree. So, basis on this calculations, it can be concluded that there is a small statistically monotonic correlation between the size of the medical facility and its collection and the use of structured data. Conclusion. The quantitative analysis of the research carried out and presented in this article made it possible to determine whether medical facilities in Poland use big data analytics and if so, in which areas. Thanks to the results obtained, it was possible to formulate the following conclusions. Medical facilities are working on both structured and unstructured data, which comes from databases, transactions, unstructured content of emails, etc. According to this analytics, they reach for analytics in the administrative and business as well as in the clinical area. It clearly shows that the decisions are made are largely data driven. The results of the study confirm what has been analyzed in the literature. Medical facilities are moving toward database healthcare and its benefit. In conclusion, big data analytics has the potential for positive impact and global implications in healthcare. Limitations and future work. The research described in this article does not fully exhaust the questions related to the use of big data analytics in Polish healthcare facilities. Only some of the dimensions characterizing the use of data by medical facilities in Poland have been examined. In order to get the full picture, it would be necessary to examine the results of using the structured and unstructured data analytics. Thus, future research may examine the benefits that the medical institutions achieve as a result of the analysis of structured and unstructured data. Future research has virtually endless possibilities. This regards the use of big data to knows specific conditions, propose an approach that can be used in other healthcare applications, and create mechanisms to identify patients like me. Big data analytics could also be used for studies related to the spread of pandemics, the efficacy of COVID treatment, or psychology or psychiatry studies. Example, emotion recognition. These are the references.